take a pregnancy test and they are not sure if the result is true or not. Why? Because sometimes they can make some errors while taking the pregnancy test. So this is a video on how you can do your pregnancy test correctly without making an error. The things you should take into consideration before doing your pregnancy test. So stay tuned and listen. Welcome back to Talk Pregnancy with Dr. Nuella, where we tell you all about pregnancy and other women-related health issues. So today we're going to be talking about how to take a pregnancy test correctly. So please, if you're new to our channel, please click the subscription button and also the notification button, such that if there's any new video, you're going to be the first to receive it. So how do you take a pregnancy test correctly so that at the end, once the result comes out, you are sure you did the right thing? The pregnancy test, what does it measure? It measures the hormone called the human chorionic gonadotropin hormone. So this is the hormone which is produced once you are pregnant. So it measures the level of this hormone produced in the body. You can either use a urine or the blood in order to test this hormone in the body. So once you test this hormone, if it's positive, it means you are pregnant. If it's negative, it means you're not pregnant. So when is it proper to do the pregnancy test? Once you have missed your period, in a woman who has a regular cycle, just the next day it's okay to do your pregnancy test. If it's positive, then it's positive. But in women who have an irregular menses, you can give like 1 week after before you do the pregnancy test in order to be sure, because if you do it early, it might be negative when in the long run it turns to be positive. So it's important you know when to do it. You should not wait. You should not have sexual intercourse today and you wait 1 or 2 days. So if you're anxious, 1 or 2 days, 1 week after, and you're doing the pregnancy test to know if you're pregnant, it might be negative. So you should give at least some time before you do the pregnancy test in order to be sure. So once you buy your test strip, maybe if you want to do the urine test, which is 99% accurate, once you buy your strip, you need to make sure you read the leaflet. Why? Because there's a given time. If you read the results early or if you read it too late, so you need to read the time which is given in order for you to read your results. So now, once you take your strip, you read the leaflet and you check the expiring date, because it's very important. Once it's expired, it can give you a faulty result. So how do? You take your urine very early in the morning, and most women tend to drink a lot of water in order to produce more urine. But once you drink this lot of water, it tends to neutralize this hormone, this human chorionic gonadotropin hormone in the body. So it's not advisable to drink a lot of water. It instead needs more concentrated urine. So you take the early morning urine and you put in a clean container and you urinate inside. Make sure it's dry and does not contain anything. Some women even take their urine, put salt inside before doing the test. All these things might cause a faulty result. So once you take your early morning urine, you don't add anything into it. You take the strip and you dip it into it. If it is the other strip which needs you to drop, it comes sometimes with the pipers, which you're going to collect the urine from the cup and drop it into the position. So once you drop it or you dip the strip into the cup, you put it down on the flat surface and you wait for the number of minutes it's needed. Most of the times 2 to 3 minutes. By that time, it should already show you the results. If you take it early, it might be negative. If you read it early, it might show negative. And if you read it after a long time, it might show positive at the end when it is not positive. So it should be within the minute which you have read in your test strip. So that some strips will say positive, there are some strips that will just say positive, showing a P. Some other ones will say 2 lines. If you see 1 line, it's negative. If you see 2 lines, then it's positive. So when you have this test which is positive, it doesn't end there, because this pregnancy might not be formed properly. So it's good to always confirm all your pregnancy tests with an ultrasound scan, because once you do the test, it's positive. It will show you positive in the case of an ectopic pregnancy, in a missed abortion where the baby has not grown inside well, in a blighted ovarium. These are situations where the baby has not grown, the egg was fertilized but it was malformed. So the egg, you see the gestational sac in the womb, but you see no fetus inside. So with all these, it's important, once you have a pregnancy test positive, it's good to go to the hospital and do a follow-up and do an ultrasound scan. And with this ultrasound scan, it's going to tell you where the baby is and also if the baby is forming so well. So after that, you finish, you discard everything. If this was helpful, please give us a thumbs up to our video, and if you want us to discuss about anything, you can drop it on the comment section. And if you want to have a private chat with me, you can click on the link below and get to me. Thank you very much. God bless you.